research certainly shows that diet is a very important part of acne treatment. It's not the whole story, but it certainly is. Research now would support using some diet modification, particularly looking at GI, glycaemic index, in modifying your diet. Glycaemic index is an indication on how different foods elevate the sugar or glucose in your blood. Certain foods will elevate your glucose rapidly, fairly rapidly, and other foods will have a slow elevation in your glucose levels. So the foods that are rated up 70 to 100 will actually elevate your glucose levels fairly rapidly, whereas the foods less than 50, 55 will have a slower elevation in your glucose levels. The foods that are best for patients with acne are the low GI foods, so foods with a GI level 50 to 55 or less. Multigrain foods, multigrain breads, multigrain cereals, whole grains, and also certain fruit. Raspberries particularly have a low GI. Pears with skin on have a low GI. And examples include foods which are highly processed, so white bread, and also highly processed cereals, and also white mashed potato and non-diet sugary drinks. It will certainly help, and certainly in my management plan when discussing with patients, I always emphasise the appropriate diet, a diet which has a low GI diet. There are also a lot of facets to acne management, and if a diet modification hasn't helped, then you should seek help from a general practitioner. The most common question I get asked is, how soon will their acne get better? It's difficult because it depends on the severity of acne. If it's a milder type of acne, it will tend to get better earlier, and that's weeks. But if it's a more severe type, then you're looking at months. The important thing to understand is being on the right combination of treatments, topicals and also oral therapies, it will gradually get better over time. It's not an overnight thing. People expect the magic pill or the magic cream, and unfortunately we haven't got that.